Your doctor would like you to watch this tape to help you understand the diagnosis of depression and the treatment prescribed for you. Clinical depression is not a blue mood you can snap out of. It's an illness like arthritis, diabetes, or high blood pressure, and affects the whole body, including your physical being, mood, and thoughts. It's important for you to know that depression is not something you brought on yourself, and does not mean you have a personal weakness or just can't cope. Rather, clinical depression, like diabetes and thyroid disease, is thought by some to be caused by a chemical imbalance. The imbalance that leads to depression involves chemicals in the brain known as neurotransmitters that are believed to be important in regulating mood and other aspects of our personality. Additional factors, such as a stressful environment and other psychosocial factors, may trigger the onset of depression. Depression is not a rare or even unusual illness. In fact, even though right now you may feel isolated and alone, you actually have lots of company, as depression affects an estimated 9 to 14 million Americans. But how does your doctor know you have depression? A combination of symptoms that may vary widely from person to person helps your doctor make the diagnosis. You may have been feeling very sad for some time, had feelings of guilt, helplessness, or thoughts about suicide or death. You may have lost interest in activities you used to enjoy, perhaps being nervous or anxious as well. Maybe you thought you would snap out of it in time, but you have not. For most people, the most frightening of these symptoms are thoughts of death or suicide. Having these thoughts doesn't mean you'll act on them, but it is important to discuss them with your doctor. They are a common symptom of depression, just as fever is a common symptom of the flu. Depressed individuals may also experience some or all of the following symptoms: a change in weight, appetite, or sleeping patterns. Perhaps you found it difficult to concentrate or felt fatigued. Headache, back pain, or stomach ache can sometimes be symptoms. You don't have to have all or even most of these symptoms to be diagnosed with depression. You've probably had some of them before, and they just went away. But when they won't go away, they may suggest the diagnosis of depression. Now, how is depression treated? Over 80% of those who suffer from depression may be helped with treatment, including various types of counseling or psychotherapy and/or a class of medications called antidepressants. Antidepressants are thought to work by restoring a normal chemical balance within the brain. Your doctor has decided to treat your depression with an antidepressant called Prozac, with the chemical name fluoxetine hydrochloride. Prozac helps to correct a chemical imbalance by increasing the brain supply of a neurotransmitter called serotonin. It does this by blocking the pump that removes serotonin from its site of action in the brain. Some antidepressants, in addition to affecting several neurotransmitters involved in depression, also interact with several additional systems throughout the brain. Laboratory tests have shown that Prozac selectively blocks the serotonin pump, affecting only serotonin. This selectivity may explain why Prozac tends to cause fewer of the disturbing side effects, such as drowsiness and dry mouth, seen with many other antidepressants. Now, how soon will you start feeling better? For those who respond to appropriate therapy, including antidepressants, improvement will be gradual, so don't get discouraged. Although some symptoms will probably improve after 1 or 2 weeks, it can take up to 4 to 6 weeks to feel any significant improvement. Take Prozac only as directed by your doctor. If you miss a dose of Prozac, Don't try to make up for it by taking a double dose the next time. Just continue with the next scheduled dose and try not to miss any more. Of course, no medication works for everyone. So if symptoms seem to worsen or you notice troublesome side effects, contact your doctor. Your doctor will probably want you to keep taking Prozac for a while after you feel better to prevent a relapse and will tell you when to stop taking it. Can you take any other medications with Prozac? Sometimes when drugs are used together, the chance of side effects increases. So before you start taking Prozac, tell all of your doctors about any prescription or non-prescription medications you now take or recently stopped taking. While taking Prozac, call your doctor if you plan to take another medicine or plan to drink alcohol. Prozac should not be taken at the same time or soon after stopping medications known as monoamine oxidase inhibitors, or MAOIs. And don't take MAOIs within 5 weeks after stopping Prozac. Some brand names of these are Parnate, Nardil, and Marplan. Does Prozac cause side effects? All drugs have side effects. Fortunately, Prozac tends to cause fewer of the bothersome ones, such as dry mouth, constipation, drowsiness, and weight gain, often seen with many other antidepressants. The most common side effects of Prozac are mild and usually go away within the first few weeks of treatment. These include nausea, anxiety, nervousness, and insomnia. But most patients who experience these side effects with Prozac are not bothered enough to stop taking the drug. Although Prozac seldom produces sedation or severe drowsiness, you should avoid driving a car or operating hazardous machinery if you feel your ability to do so is affected. Also, it is important to call your doctor if you develop a rash or hives while taking Prozac. You may be wondering about stories in the news media concerning Prozac. Many of the positive and negative reports have been distorted and sensationalized. A number of news media reports have presented inaccurate and highly emotional discussions about Prozac and the issue of suicide among depressed patients. Your doctor is the best source of medical information about Prozac or any medicine you take.
It may be reassuring for you to know that the scientific and medical communities have carefully reviewed scientific data relating to use of Prozac and suicide. They have concluded that the evidence does not show an increase in suicidality with Prozac. As mentioned earlier, suicidal thoughts or behavior are common symptoms of depression. In clinical trials, suicidal thoughts, like other symptoms of depression, decreased in patients who responded to Prozac. However, if you begin to have suicidal thoughts, you should contact your doctor.
Finally, you're probably wondering if there is anything you can now do to help yourself. By seeing your doctor, you've already taken the most important step. Be sure to follow your doctor's instructions. Take Prozac as directed, and keep all appointments with your doctor. If your doctor has advised you of the benefits of counseling, proper diet, regular exercise, and other activities, follow these instructions as well. Your doctor may also advise you to involve a family member or close friend in your treatment. As with many other illnesses, they can help keep track of your progress. Although this video has provided important information about depression and Prozac, it does not contain complete information on these subjects. Don't hesitate to ask your doctor if you have questions or concerns about depression or Prozac. Remember, appropriate treatment can help most people who suffer from depression. By seeking treatment, you're on the road to recovery.